morning, everyone. My name is Maya Luria with TMC for Seniors, and we are continuing on with our Fall Prevention Month. And today we're going to be talking about prescriptions and pitfalls, how medications impact fall risk. I have the pleasure of introducing you to Dr. Katherine Dowell. She is with TMCOne at the office that is on the northwest side. And Dr. Dowell actually specializes in geriatric medicine. And I'm so glad that she is here with us today so that she can share more about this topic. How are you, Dr. Dowell?
I'm doing well. Happy to be here.
Great. So I've got your PowerPoint here. I've gone ahead and put that up for you so that you can go ahead and get started. You do have an online audience along with an audience that's in person there today. And so if you have any questions and you're at home, please feel free to enter those comments into the chat, and I will ask Dr. Dowell when she wraps up her presentation. I'm going to turn it over to you, Dr. Dowell.
Hello, everyone. I'm Kate Dowell. I just want to tell you a little bit about myself. So I'm from Texas. I grew up in Dallas. Oh, yeah? Okay. San Antonio. All right. I lived in Austin for a little bit, so right near there. I did my undergraduate training in Texas, my medical school in Fort Worth. I did my residency in East Texas, and then I came here to the U of A to do my geriatrics fellowship. And now I work at TMCOne. So that's a little bit about me. I know y'all are all here to hear about medications that increase fall risk. So let's go ahead and get started. All right, so some objectives, some things that we're gonna talk about today. One, the importance of decreasing fall risk, which I'm sure everyone here is probably very familiar with. We're gonna talk about certain medications and how they increase fall risk. Beers criteria. Don't get too excited, it's not what you think, but we'll go into that. And then some over-the-counter medications that can increase your risk of fall, and then we'll talk about supplements. So the importance of decreasing fall risk. So lots of reasons, but falls are actually the leading cause of injury-related death in older adults. Falls can lead to hospitalizations, breaking bones, pain in general, brain injury, internal bleeding, and just in general, decreased quality of life. It can kind of put you out of commission for a while, right? So we really want to avoid falls if we can. So this is about basically why older adults are more affected by certain medications and why older adults have an increased risk of fall from medicines. So as we age, our bodies have less water and less mass. So we're losing some muscle and we're gaining some fat, right? And different medicines are metabolized in water or fat. So medicines that you take can either be increased in your body or decreased in your body based on how they are metabolized. Does that make any sense? So some medicines can take longer to reach their full effect, but they can also stay in your body longer so that effect stays in there longer. All right. So another reason why medications can affect fall risk is drug-drug interactions. So as we age, we tend to be taking more and more medicines, right? What drug-drug interactions are is if you're taking one medicine, that taking that medicine itself can affect how the other one is absorbed. So if you are taking, for example, a statin medicine and you take another medicine that's processed the same way in your body, then that could either increase the amount of that other medicine or decrease that amount of the other medicine. Does that make sense? So here's just an example. Miss Q is a 72-year-old woman. She has some anxiety, some trouble sleeping, diabetes, neuropathy. Medications that she's taking, and let me know if you've heard of any of these. Some of these you might recognize. Ambien, probably for sleep.
Yeah.
Nortriptyline, that can be used for anxiety, depression, and sleep. Glipizide, metformin, diabetes medicines. Lyrica, which can help with nerve pain. And then she says just a generic over-the-counter sleep medicine. So tell me what y'all think. Which of these are possibly increasing her fall risk?
Ambien and the over-the-counter sleep medicine.
Ambien, over-the-counter sleep medicine. Okay, very good. Anybody else?
Pain medication too. The pain and the Lyrica.
Pain medication, the Lyrica. Very good.
Yes.
So you're all correct. It's actually all of them. Okay, and we'll kind of go through why. So yes, definitely Ambien, that in and of itself can cause you to be lightheaded and increase your risk of falls. We'll get into those in a little bit. Nortriptyline as well. So it has some properties in it that can make you really dizzy, can cause different heart arrhythmias, cause you to be more likely to fall. The glipizide and metformin. So metformin is really a fairly safe drug, right? However, like we were talking about, medicines interact with each other, right? So when it's taken with something like a glipizide, another medicine for diabetes, it can really lower your blood sugar. Low blood sugars can be really dangerous, right? So we don't want your blood pressures being very high, but a low blood sugar can cause lots of different problems, including falls. And it can even be more dangerous than that. So you really want to watch out for low sugars. You had mentioned the over-the-counter sleep medicine. Why did you say that?
Well, a lot of the over-the-counter sleep medicine is very similar to Ambien, used in a smaller dose. But you take the Ambien and then you're mixing it with the sleep medicine, you're lucky to be walking.
You're not wrong. You're not wrong. So yeah, a lot of times when people say they're taking a generic over-the-counter sleep medicine, we're thinking, okay, well, it's over-the-counter, it's generic. It can't, what harm could it do, right? A lot of times that medicine has Benadryl in it. That's kind of the main component. That's what makes you sleepy, right? Medicines that can make you sleepy can make you drowsy and lightheaded, more likely to fall. So, and we'll talk about it a little more in a little bit, but Benadryl is actually one of the medicines that I really want older adults to avoid. It can actually cross that blood-brain barrier and affect your brain more than other antihistamines, other allergy medicines, things like that. Which is why it's a good sleeping medicine, but can cause other problems, right?
Oh, excuse me,
Yes, ma'am.
I know that Ambien, when it first came out, you could sleepwalk on Ambien.
Mm-hmm.
I'm a person who could sleepwalk on Ambien, and they had to discontinue it because I lived in a two-story home.
Mhm.
So it was awful for me. And there are the medications out there that are just wonderful.
Exactly.
You don't have to take as much either. And, but Ambien was, I was on a plane coming home from Alaska, and this lady had a problem, and I called for medical people to come forward. Well, I waited a while before I answered that call, but she had taken an Ambien, and her daughter gave one to her to take when she got on the plane so that she could sleep. And it really created havoc on her. Yeah.
Especially when you're on an airplane at 39,000 feet in the cockpits, or, inside of the airplane's at 8,000 feet. So now you're at 8,000 feet, where you used to be at sea level, and then you put Ambien on top of that. Yeah.
Absolutely. You really have to think about different people.
Yes.
Different medicines work differently on different people.
Yes.
And they work differently at different ages. So something that worked for you when you were younger might not work for you when you were older.
Repeat what they said. ahead.
Oh, I'm sorry. So yes, she was saying that she witnessed an experience on a plane where someone had taken, an older adult had taken an Ambien.
Her daughter had given her that Ambien, one Ambien, just to take on the plane
Yeah.
so she could get some sleep.
Her daughter had given her the Ambien to take on the plane so she could sleep.
She and her husband had been walking around Anchorage all day, and they didn't eat a lot, they didn't drink a lot, and she was a mess with this Ambien. She really was.
And she had really bad side effects with the Ambien, just was not acting herself and
Yeah.
lots of problems.
Lots of problems, and and I did answer the call, and they got the doctor on the phone, and I watched her while we were in our first hour of our flight because.
Well, I'm glad you took care of her.
Yeah, but it was.
And our environments, like you were saying, our environments, being up high in the plane can change the way we're acting too. So these are a couple kind of busy slides, but you might recognize some of the colorful words. Okay, so different types of medicines that are on the Beers criteria. So getting to that Beers list that we were talking about. It has nothing to do with alcohol. All right, but it's actually, I know, darn. There's actually a geriatrician, Dr. Mark Beers, who created, several decades ago, who created a list of medicines that are probably best to maybe avoid in older adults. They can have negative effects or bad interactions with other medicines that can cause problems in older adults. So that's actually been carried on and transformed, throughout the years. They have big updates. The American Geriatric Society is working on updating it. They just had a big update last year. So it's a really good reference point, but it's very long and tedious. So I kind of broke it down a little bit to show you these are medicines that, according to that list, can really increase your fall risk. So things you might recognize, so antihistamines, things like hydroxyzine can be used for anxiety, itching. They can sometimes help with sleep. Benadryl, as we already discussed. It can be an allergy medicine, which I would recommend against using it as an allergy medicine. It can be used as a sleep medicine. Unisom, also a sleep medicine. You might have heard of Phenergan or Dramamine, which helps with nausea. Then benzodiazepines are one of my least favorite medicines. They can be very helpful in certain situations, but things like Xanax, Klonopin, Ativan are used for different things, right? So they can be used to help people sleep. They can be used for anxiety. Using it, one time can make you more likely to fall. But then there's also the increased risk of taking it on a regular basis that can cause lots of problems, including, cognitive dysfunction and things like that, but can really increase your risk of falls. With these, there are also some last in your body longer than others. So if you take it at night, you want to check and make sure you're taking just one that just acts for a short period of time. I would rather you not take it at all, but if you have to take it one that's shorter so you don't wake up in the morning feeling groggy and fall. Does that make sense? Other ones, we call them Z drugs, but they're medicines that are used for sleep. Things like the Ambien we were talking about, Lunesta, are maybe some names you've heard of.
Lunesta is a good drug.
It is a good drug, but it is a good drug for what it does.
Will you save your questions and stuff till the end?
Oh, I'm sorry.
Oh, yeah. And then there's some antidepressants. So again, some of these antidepressants are really great drugs, like Elavil, nortriptyline, can also be used for sleep, anxiety, depression, and paroxetine have all been shown to increase your fall risk. And then anti-seizure medications, things like gabapentin and Lyrica, they're called anti-seizure medications, but we found other uses for them, right? Like the nerve pain, things like that. Again, can be very helpful for nerve pain, but can increase your fall risk. Blood pressure medicines. A lot of us are on blood pressure medicines, right? It's important to have not a high blood pressure, but again, having a low blood pressure can be dangerous too. When your blood pressure is low, you feel kind of woozy and off balance, right? Anybody experience that? Yeah. And then we kind of already talked about some of the diabetes medicines. Some of them can really lower your blood sugar, and you want to avoid low blood sugars. These are, I put on here CNS active agents. So that's basically medicines that work on your brain, spinal cord kind of thing, okay? A lot of these are medicines we've already talked about, and it's been shown in the guidelines that, you know, a lot of these in and of themselves can cause increased fall risk, but if you're on 3 or more of these, it can significantly increase your risk. So that's just something to kind of look out for, scan your medicine list and see. Oh, a couple that we did not talk about are opioids, so pain medicines, muscle relaxers, so Flexeril, cyclobenzaprine. Sometimes when you're having pain, somebody will prescribe you a muscle relaxer. For some people, it really helps. If it's not helping, let's not take it. And then some medicines like oxybutynin are used for, you know, overactive bladder. Urinary incontinence can also cause increased risk of falls. Then we have some over-the-counter medicines. We already talked about Benadryl. Tylenol PM. You know, again, we think it's Tylenol. What harm is it going to cause? But the Tylenol PM part is what can increase your fall risk. NyQuil, same thing. So let's talk about somebody else. This is actually, you know, this is obviously not his name and it's different age, but this is someone that I saw in clinic. Mr. M, 68-year-old man, came in with severe balance problems, could barely get in the door, feeling very lightheaded, feeling like he had some brain fog, just wasn't feeling right, and it was really affecting his life. He could, you know, barely get into the office. So we went through his medication list. I asked him, what are you taking? And he responds, you know, a blood pressure medicine, a diabetes medicine, and every once in a while he'll use an inhaler for asthma. And that's pretty standard, right? When somebody asks you, what medicines do you take, you name all your prescription medicines, right? So then it's important to also say, what supplements are you taking? When I asked about his supplements, he pulled out a huge bag full of all kinds of supplements. And we went through a few of them, and I was like, you know, why are you taking this? And to most of these, he says, well, I don't know. I just heard that they could be helpful. You know, they can help with my health, right? So why not? Let's take them. So we went through, and I thought, you know, let's just stop these medicines. Not saying we should ever just stop medicines. Don't ever just stop medicines without talking to your doctor first, okay? Because then that can cause other side effects. But with these, we decided let's just stop all the supplements, keep your regular medicines, we'll stop them and see how you do. He came back a month later, strolled right into the office, feeling fine, no problems walking. He said, yeah, after a few days after I stopped those supplements, I felt like myself again. So these things that we take that are not necessarily prescription medicines can really have a big effect too. So some terms that are important in this discussion. One is polypharmacy, which has a lot of different definitions, but the main definition right now is the routine use of 5 or more medications. That's most of us, right? We're taking a lot of 5 or more medications. Yeah. So polypharmacy in general can really increase your risk of falling, right? And that makes sense with all that we've talked about. So you can have the drug interactions. You're more likely to have multiple of those medicines that can affect your brain, right? And Then there's also just the pill burden. You have a ton of medications to take. It's hard to remember when you're supposed to take which one, and maybe I skipped this one, I'm not sure. Or I've just taken too many medicines today, I'm not going to do those. It can be tough. So one of my favorite concepts is deprescribing, which is a term. Let's cut back on as many medications as we can. Let's be on as few medications as possible. Some medications it's really important to be on. We have to kind of decide which ones those are, right? It's really important with every medicine that you're taking to really look at the risks and benefits. So talk to your provider, your pharmacist. Why am I taking this? And is that helping me more than it's hurting me? Make sense? Then there's the prescribing cascade. And this might sound familiar to some of you. This is basically a concept of you take one medicine, that causes a side effect. Then that side effect is treated as a whole new medical problem. So you're prescribed another medication that's actually treating that side effect of the other one. So an example is, say you're taking a blood pressure medicine like amlodipine. Wonderful blood pressure medicine. And some people, it can cause ankle swelling. So this person who's taking this blood pressure medicine starts getting swelling in their legs. So what do you do if there's swelling in your legs? You take a water pill, right, to get that fluid off. So then they're prescribed a water pill to treat the swelling. Well, then that person says, well, now I have to urinate all the time. So now I have this urinary frequency. Well, let's start oxybutynin for the urinary frequency. You see where I'm going? So now we have 3 medicines, all of which can be potentially dangerous and increase your risk of falls, when really we could have maybe just changed that blood pressure medicine to a different one that wouldn't cause ankle swelling. So, take-home points. When your provider or anyone asks which medications you're taking, tell them all the medicines you're taking. Prescription medicines, over-the-counter medicines, supplements, anything you're taking. That's important. Then, if you're having symptoms you're concerned about, ask your provider if any of the medicines you're taking could be causing these, because that's honestly one of the first things we look at as geriatricians. When somebody comes in, we're like, okay, let's look at the medicine list and see if any of these medicines could be causing the problem or worsening it. Then try to understand why you're taking each of your medicines. And I know it can be overwhelming when you're taking a list of medications, right? To know, well, this is my blood pressure medicine, I'm taking this for pain, it's tough. But really try to understand and have a reason. Make sure you and your provider know there's a reason for taking this. Because a lot of times we can come out of the hospital or change providers and we just keep on prescribing it because that's what they've been taking, And then lastly, if you're concerned about your balance, decreased sensation in your feet, difficulty walking, lightheadedness, dizziness, or just fear of falling, which most of us have, talk to your provider, talk to your pharmacist, ask them to go through your medicines and say, could any of these be contributing or working together to contribute to my fall risk? So that is all I have today, but what questions do y'all have?
So we'll do.
We'll do the questions with Maya first, I'm sorry.
Yes, thank you so much, Dr. Dowell. So I do have a couple of questions that came in, and so that I wanted to check with you on. One is, how often should somebody maybe have their prescriptions, reconciled with a pharmacist? What does that look like? How often would you be doing that with a patient?
So honestly, from a geriatrics perspective, ideally, you would be reconciling your medication list at every doctor's visit. Every time you go in, every time you see a new provider, you go through and say, this is what I'm taking. So it's actually really helpful, maybe cumbersome, but it's really helpful to even bring your medicines in, all the medicines and supplements you're taking, bring them in so you're not stuck in the position of, oh, I don't know what dose I'm taking on that, or, well, I thought I was taking this, so it's hard because we have, shorter appointments than we would like, but that's a really important thing, is to go through that medicine list every time.
Okay. And when they also do that with their pharmacist too, when they go into for their to see their pharmacist, or?
So with the pharmacist can be really busy, right? So it's hard to kind of get a hold of them. If you have questions about it, absolutely ask your pharmacist. Or if you or your provider is questioning a certain medicine, you're like, I think this medicine might be making me feel funny. This medicine might be causing me to feel dizzy. Ask them about it and see, could this be causing it? Are there any alternatives? Let me talk to my provider about it. Does that answer your question?
Yeah. Now, what about, I was going to actually mention, so for instance, tomorrow we have the No Falls Fair, which is coming up, so I'm really excited. We will actually have our pharmacist there at the event. So if people want to come and they would like to have their med list, you want to bring your med list with you, they're happy to answer questions for you while you're there as well, to see if there's any medications, right, that you might be taking that could affect, you should be maybe taking together, right, or you need to just take a look at those med lists. Are there alternative medications that might have a lower risk of causing balance problems that we can ask our provider about, that may be an option? For instance, I don't know if, are there certain blood pressure medications that have maybe less, cause on falling than others, or other medications like that?
Sure. So it depends on kind of what we're talking about. But for example, the blood pressure medicines that you were asking about, yes, absolutely. So there are certain blood pressure medicines that can be more troublesome than others. So things like, let's see, for example, amlodipine that we already talked about. But there are some medicines. Have any of you taken clonidine for when somebody says, if your blood pressure gets this high, then take this medicine? That one is one of my least favorites because it can really cause an increase in blood pressure, drop in blood pressure, make your heart rate do different things. So that's one to kind of avoid. Whereas things that are losartan, lisinopril are pretty great medicines. Things like hydrochlorothiazide or chlorthalidone, the ones that can make you pee more, are really great for certain things, but they can, in a sense, dehydrate you and make you more likely to fall, right? But again, you have to weigh your risks and benefits of all of these things, because you also don't want to have really high blood pressure. So if you need to be on 3 blood pressure medicines, maybe you need to be on 3 blood pressure medicines, and they have to be, different kinds of blood pressure medicines. So you need to talk to your provider and say, well, I'd really rather maybe take hydralazine, or I've taken this medication before and it made me feel funny. So let's avoid that one and take this one.
Great. And then do you have a system if somebody has got, I know you shared an example of the one gentleman who had the supplements in addition to his medications. If somebody is on a variety of medications, and how do I figure out which ones might be affecting my fall risk? And then what should we do? How do we share that back with our provider if we don't exactly know which one it is?
Yeah, that's a good question. So several things. One, when you start a medication, it's important to just start that medicine and not make several medication changes at one time. So if you start feeling lightheaded or dizzy on one, then when you just made a medication change, maybe that's the culprit, you know? Otherwise, you can, you know, kind of go through this and see, you know, these are the top candidates of things that are going to potentially make me fall. Am I taking any of these? Another thing that I think is important to do with your provider, like I kind of mentioned before, is why are you taking this medicine? You know, what is this medication doing for you? If that is a heart medication that is going to keep you from getting a stroke, by all means, we should keep that one. You know, but talk to your provider and say, if you're not sure why you're taking something, say, are there other options here to be taking this, or do we even need to be treating this? Is it better to have a better quality of life and not fall than it is to take this medicine?
Thank you, Dr. Dowell. Now, what about do you have a suggestion for something that somebody could take if, for instance, they shouldn't be taking Benadryl, but they're looking for something maybe to make them a little bit sleepy, or what other options would somebody have that might be maybe a better suggestion?
Yes. So, and these questions are kind of, they're the questions we're all asking, right? Of, well, then what can I take? And again, that's where the risks benefits comes in. But if you're taking Benadryl for allergies, I would take something different as far as maybe like a Zyrtec or Allegra. Zyrtec can also make you sleepy, so you can take it at night. Allegra is, out of all of the Claritin and all that kind of thing, it's the one that's the least sedating. So it's the one that'll, out of all those medicines, cause you the least likely to fall. There are also alternatives to that, like nose sprays, that I think actually work better than than the pills. But and if they work for you, then you don't have as many of the systemic effects, right? But those medicines don't cross the blood-brain barrier like Benadryl does. If you're using it for sleep, this is the tough one for sleep, right? So there are definitely things like melatonin, which really works for some people and really doesn't for some other people. So what I like to say when someone's having trouble sleeping is, let's figure out why. Why are you having trouble sleeping? Are you having trouble getting to sleep or staying asleep? If you're having trouble getting to sleep, why are you having trouble getting to sleep? Is your mind racing? Are you thinking about what's happening the next day? Are you thinking about what's happening 3 states away with your kids? Or, you know, what's going on that's making you not get to sleep? That's where things like melatonin can come in, but you also have to see the time frame that works for you. So sometimes the melatonin can take 30 minutes to kick in. Sometimes it takes 2 hours to kick in. If you're having trouble staying asleep, what's waking you up? Do you have to get up to go to the bathroom? Well, let's address that. Are you waking up because your feet hurt? You know, are you in pain? Then we can address that. Are you waking up because you're having nightmares? You know, and address the cause of what's happening. Does that make sense? And then there's also things that have nothing to do with the medicines, and it's just, what is your routine? What is your sleep routine? You know, make sure that you stop drinking water a couple hours before you go to bed, and go to the bathroom between when you stop drinking water and when you go to bed. Don't have the TV on or your phone on, anything with a screen, about an hour before you go to bed. Some people like to journal or things like that, and just kind of, you can do things on your own or work with your provider and figure out what's making me not able to sleep, and kind of address it from there.
Yeah, sleep hygiene is so important, I know, and we've had some classes in the past where they've also shared some apps that are really great to sort of help you to get to sleep as well. Sort of like the counting sheep, but not counting sheep. Probably a little more soothing. So that's great advice. I did have somebody ask me just about balance classes. to help also with falling. I'm assuming to maybe get your strength and your balance back up as well could be helpful.
Definitely. Physical therapy, balance classes are amazing. And anything to, increase your strength, but also some of it's a little bit mental too, right? When you're worried about falling, you're more likely to fall.
Mm-hmm.
So the more confident you feel, the better. So absolutely, if there's a balance class available.
Right, and we do teach Tai Chi here as well. So we have Tai Chi classes, both seated and standing. So there are some options. There are others around Tucson as well that are great options too. I do want to just share, if somebody wanted to make an appointment with you, you are accepting patients, correct? New patients?
Yes, ma'am.
And I'm going to go ahead and just put up here, if you're interested in an appointment at TMCOne, you can call 520-324-4910. This is Dr. Dowell that is here today. And tell them where you're located as well, Dr. Dowell.
So we're on Oracle and Ina. If you know where that Whole Foods is over there, it's kind of catty corner from that Whole Foods.
Great.
Yeah.
Thank you so much. I'm so glad you were here today, and we look forward to having you back in the future. I'm going to wrap it up with our online audience, and then I'm going to turn it over to you to answer any questions for our in-person audience. Thanks for being here, Dr. Dowell.
Thank you so much.
I'm ready.
Thanks again for being here. We look forward to seeing you again. Tomorrow is the No Falls Fair. We do have a few spots left if you are interested in attending the fair. That will include some assessments as well. If you're interested in attending, we do ask that you sign up for a time slot. That'll help you to get one of the mini fall risk assessments that we're doing at the event. And the event will take place at the Tucson Jewish Community Center, and that is tomorrow, Wednesday, September 18th from 10 to 12. If you would like to attend, please give us a call in the office for an appointment. The phone number is 520-324-1960. And we will see you again next week online. Our next class is going to be on Tuesday, September 24th at 10 a.m. And that will be Mood Food, Beyond Comfort Food with Mary Milady. Again, the phone number here is 520-324-1960 if you would like to sign up for that class. Thanks again and have a great day.